Well, I went to Baylor University. I grew up in Kansas City, Missouri, and headed to Texas at the age of 18. And after 4 years at Baylor, and we all know they're Baylor Bears, right? I mean, sick of Bears. I graduated with a major in religion, but also pre-med. And so I applied for medical schools and went to Yale University up in Connecticut, and then stayed on at Yale New Haven Hospital for the 5-year orthopedic residency. And then after that, I decided to subspecialize in foot and ankle. And so I headed down to Scottsdale and Mayo Clinic to do a year fellowship in foot and ankle surgery. And then after that, I started my practice in Texas. So I'm a mother of 2 kids, both under the age of 10. And my husband and I like and enjoy keeping up with them. And that means activities like karate, swimming, gymnastics, music lessons, things of that nature. And if we're getting together as a family and doing things outside, swimming and bike riding, I'm teaching my son how to ride off training rails, and that's tricky, but we're making progress. We have a new addition to our family, and it is a 1-year-old boxer puppy named Ruby. And so as a family, we're learning how to walk the dog rather than letting the dog walk us, and we're learning different ways of dog training, and so that's been fun and challenging. I used to live in Corpus Christi before coming here, and for 13 years I had a foot and ankle orthopedic practice down there. And so in Corpus, there are different activities to do outside, like we would go to the beach, and we liked very amateur sailing and surfing a little bit. One of the neat things about Corpus is that it's the birdiest city in North America, so we would go bird watching, and that was fun at different times of the year to do together as a family. I have recently decided to learn a little bit more about video games, because I figure if you can't beat them, join them. And when it's so hot you can't go outside, although we do limit the time with my son, I'm learning Booga Booga and trying to understand what's so compelling about that and be kind of part of his life in a different way. And we're looking forward as a family to exploring the Dallas-Fort Worth area and all the exciting activities we know are here. Knowing that I'm needed and doing something of value for someone else. And what I have found with my patients through orthopedics is that they provide this sense for me. I have been grateful to patients who tell me I have a good bedside manner because I spend time getting to know a person, and I enjoy doing that. I want to work together to understand the problem and collaboratively look for a solution that meets that individual's needs. Orthopedics is a very hopeful and satisfying field because often musculoskeletal problems have a fix. Now, that fix doesn't have to be an operative fix, and usually my focus is non-operative treatment if it can be. Sometimes, though, the best way forward is surgery, and I understand how scary and intimidating surgery can be. And so I try, along with my team, to be present and available for my patients and to help alleviate fear and answer questions all along the way and during the healing process. So that even though it's a difficult situation, it becomes a good experience overall for you. On a personal note, my mother, at the age of 6, contracted polio and went from a very vibrant child who was very active to one confined to a wheelchair for the rest of her life. And watching someone I loved deal daily and struggle with physical disability greatly affected me. There was no fix. There was no recovery. There was coping with physical difficulties and what that meant daily. And all I could do was help with activities of daily living to alleviate some of the struggle. When I see a patient come to me in my office who can't walk because of a physical injury, and after 2 to 3 months of recovery, and they're walking out the door on their own 2 feet, and they're getting back to the life that they want to lead, and they're continuing that forward progress, that is what brings me joy. And that's what inspires me to get up in the morning.